Continuing with acetylol and pindolol, which are antagonist and partial agonist activity. They are actually antagonist, but they also possess partial agonist activity. What are their actions? Cardiovascular, beta 1 selective. This is beta 1 selective, and this is non selective, beta 1 and beta 2, and they are not pure antagonist. Now see what happens when they act as agonist. The agonists such as epinephrine, which is purely agonist, beta 1 and beta 2, it will activate these receptors. For antagonist, when it comes, it will prevent the attachment of agonist and it will deactivate its functions. Partial agonist means beta 1 and beta 2 will partially be activated and will be unable to respond to any other potent catecholamines, so the effect will be decreased. Decreased metabolic effects. And therapeutic uses, they are effective in hypertensive patients with moderate bradycardia. You can see here, this is a summary of beta blockers. We will see one by one. Now, for hypertension, which are the drugs? Propranolol, metoprolol, and other will reduce cardiac output and renin secretion. For glaucoma, timolol and other will reduce secretion of aqueous humor. For migraine, prophylaxis. Thyrotoxicosis, they will reduce cardiac rate and are potential for arrhythmias. Arrhythmia prophylaxis after MI. Propranolol and metoprolol will reduce cardiac output and release supraventricular tachycardia. Propranolol and ismolol will slow AV conduction. For angina pectoris, propranolol, nadolol, and other will reduce cardiac rate and force. These were the clinical applications. Now, labetalol and carvedilol. They are antagonists for both non-selective alpha and beta both. So therapeutic uses, it is used as an alternative to methyl dopa in the treatment of pregnancy-induced hypertension. This labetalol. But the drug of choice for pregnancy-induced hypertension is still methyl dopa. IV labetalol is used for hypertensive emergencies also. Carvedilol as well as metoprolol, bisoprolol are used with patients of chronic heart failure (CHF). They will block the effects of sympathetic stimulation, which will worsen the heart. Now, its adverse effects are orthostatic hypotension, dizziness. Now, this is the summary of sympatholytics. Propranolol, non-selective beta blocker, used in hypertension, migraine prophylaxis, hyperthyroidism, angina pectoris, and MI. Nadolol, pindolol, also non-selective but only used in hypertension. Timolol, also non-selective, used in hypertension and glaucoma. Timolol is topically used. Atenolol, bisoprolol, esmolol, and metoprolol, selective beta 1. And hypertension, angina, MI, atrial fibrillation, mainly it is used in the heart. CHF. Acebutolol, selective beta 1 but used only in hypertension. Nebivolol, beta 1, and it will increase nitric oxide by used in hypertension. Carvedilol, labetalol, alpha blockade also and beta blockade, so used only in hypertension. Major therapeutic uses are for atenolol and propranolol. Now, drugs which affect the neurotransmitter release or uptake. Rizarpine. Rizarpine is a plant alkaloid which will block, what is the mechanism? Magnesium adenosine triphosphate dependent transport of biogenic amines. These catecholamines, norepinephrine, dopamine, and serotonin, from cytoplasm into the storage vesicles. We have seen here storage vesicles in the adrenergic nerve terminals in the body tissues. This causes the ultimate depletion of amines. Sympathetic function in general is impaired because of decreased release of rizarpine is slow onset and long duration. In general, it is impaired because decreased release of it is used in the management of hypertension. It has fewer drug interaction. It is also indicated with agitated psychotic states such as schizophrenia.